If you're a small business owner, you know that offering health benefits is one of the best ways to take care of your team. But man, it can be crushingly expensive. So, when an option pops up that promises all the tax benefits of a big corporate plan, but with zero admin cost, well, that sounds like a dream come true. But this is where we run into a paradox, a situation where the promise of free can end up hiding a dangerously high price.
So let's just cut right to the chase. Here's the big question on every small business owner's mind. Can you really offer your team top-notch, tax-free health benefits for literally zero cost? I'm talking no setup fees, no monthly software charges, nothing. Is that even possible? Or is it too good to be true?
Well, that's exactly the promise of a do-it-yourself individual coverage HRA. You'll hear it called an ICHRA for short. It's a fantastic system that lets you give your employees tax-free money to go buy their own health insurance. And the DIY part? Well, that suggests you can handle the whole thing yourself, with just a simple template and a spreadsheet. But here's the thing we're going to break down today. When you're playing in the world of federal healthcare regulations, that little word, free, can suddenly become the most expensive word in your vocabulary. Let's dig into why. Okay, first off, let's be clear. The appeal of an ICHRA is completely understandable. I mean, it's a huge shift from the old way of doing things, where you had to pick one expensive group plan that might not even work for everybody. This way, you just give your people tax-free money, and they can go pick a plan that actually fits their own family's needs. So, at its core, an ICHRA is really just a special kind of account. The employer, that's you, puts money in, and your employee uses it to get reimbursed for their insurance premiums. The best part? It's all tax-free. For a small business, this is an absolute game changer. It offers flexibility and cost control that was just impossible with old-school group plans. And that leads us right into the first and honestly the most powerful myth out there, the idea that doing it all yourself is automatically the cheapest way to go. And look, on the surface, the math seems like a total no-brainer. If you use what's called a third-party administrator or a TPA to manage the process, you're going to pay for their software and support, maybe $15, $20 a month for each employee. The DIY option? A big fat zero. It feels like an easy decision, right? But hang on, the sticker price is almost never the real price. We have to look at what's called the total cost of ownership, and that includes not just the fees you pay, but also the value of your own time, and this is the big one, the cost of the risk you're taking on. Now, this is where it gets really interesting. This breaks down the actual operational costs, and you'll notice that hidden expense right there in the middle, your time, listed as internal labor. For a company with just 20 employees, the hours you or your staff spend manually tracking everything, chasing down receipts, checking coverage every single month, that can add up to thousands of dollars a year in lost productivity. All of a sudden, those DIY savings start to shrink. And trust me, we're just getting started. This quote from the source material absolutely nails it. See, when you go DIY, you're not just an administrator anymore. You legally become the plan's fiduciary. And that's a fancy word that means you are personally on the hook for any and all mistakes. So the real cost isn't the software fee, it's the massive risk you're putting on your own shoulders. And this right here, this is the real kicker. The source material calculates something called the risk-weighted penalty cost. It's basically a way to figure out the true cost of going DIY by factoring in the chance of getting audited and hit with a massive fine. And even if there's just a tiny 1% chance of an error being found, the penalties are so huge that they tack on over $7,000 to the annual cost. All of a sudden, your free option is nearly double the price of just paying an expert. Okay, so maybe it's not actually cheaper when you factor in the risk. But what about myth number 2? That it's simple, right? That anyone with a legal template they found online and a spreadsheet can handle it. Well, the reality is that an ICHRA isn't simple at all. It's a complex legal setup that has to follow the rules of 4 different federal agencies. The source material calls it a compliance minefield, and that's the perfect description. You've got the Affordable Care Act, ERISA, which protects employee benefits, HIPAA for privacy, and of course the IRS. One wrong step in any of those areas, and boom, you've stepped on a landmine. Let's just focus on one of those for a second, the ACA. If you make a mistake, like accidentally reimbursing an employee for a plan that doesn't qualify, or you keep paying them after they've dropped coverage, the penalty is $100 per day,
per employee. Do the math. That's a potential penalty of $36,500 a year for one single mistake with one single employee.
And you might be thinking, well, I wouldn't make a mistake like that. But look how easy it is. These are super common traps for DIY admins. Something as simple as storing an employee's premium invoice in their regular personnel file, that's a serious HIPAA violation. Forgetting to file one obscure little form with the IRS once a year, that's a compliance failure. A spreadsheet is never, ever going to pop up with a warning that you're about to step on one of these mines.
And that brings us to our third and final myth, which might be the most dangerous one of all, that you can just use a DIY ICHRA to reimburse anyone on your team for any kind of health plan they have.
The truth is, the eligibility rules are incredibly specific. And this is where TPA software really shines, because it's built to automatically flag these common traps. For example, did you know that S-Corp owners who have more than a 2% stake in the company can't participate? The IRS doesn't see them as employees, and you absolutely cannot reimburse for plans that aren't considered real health insurance. And let's just hammer this point home, because it's a huge source of confusion, and it's a mistake that can cost you dearly. Healthcare sharing ministries, they are not insurance. They just aren't. They don't meet the legal requirements. So if you reimburse an employee for one of these, you're committing a direct violation that could trigger that massive $36,000 penalty we just talked about. So let's pull all this together. We've seen the hidden cost of your time, the insane complexity of that 4-part regulatory minefield, and all the little eligibility traps. So what is the real cost of going DIY? It's what our source material calls the autonomy paradox, and it is the perfect way to describe this. You choose the DIY path because you want freedom from fees and control over your benefits. But what you're actually buying is catastrophic personal liability and a level of regulatory risk that, frankly, most small businesses have no business trying to handle on their own. And that means we have to completely reframe what that monthly TPA fee is. It's not just a software subscription. Think of it as a payment to transfer that enormous, potentially business-ending risk off of your shoulders and onto an expert's. In a way, it's a form of compliance insurance. And that brings us to our final question. When you use the data for a 20-employee company, the choice becomes incredibly clear. By going the DIY route, you might save, around $4,800 a year in fees? But in exchange for that, you are personally taking on a potential risk of over $730,000 in penalties. Looking at it like that, you just have to ask yourself, is that really a risk worth taking?